One, okay. Doc Ellis, your Hick doctor from Ellis Clinic in Oklahoma City. Today's June 6th. Ask Doc Ellis questions. It's on the website. Let's start right in. Got the door closed? Good. Okay, Derek. Can't find a doctor that accepts OWCP to treat my chronic fatigue and brain fog. Is it possibly treated with telemedicine of these conditions, which are symptomatic of my COVID infection? Fatigue is soul crushing. I need help. Yeah, okay. Now, if you've had COVID infection, has it been accepted as work related? It should be. If not, we can help you with that. We're not your treating doctor. That's a different issue. But to get your claim accepted for it, time off work and all the things that go with it, we can help you get that done. I'm not aware of any doctors or hospitals or what that treat it and do federal workers' comp. You may have to do it on your health insurance, but you may be able to do it on federal workers' comp. And obviously we can do the telemedicine for it to get it approved if it's not approved and get your COVID covered because it's supposed to be done. Okay, and it's the brain fog. Let me explain that. It's not long COVID, folks. You had encephalitis from a virus. All right, you have brain damage. All right. Daniel, OWCP. No, it looks like it's VA. I received my MRI on my knee after my C&P exam. That's VA. Oblique undersurface tear at the junction of the body and posterior horn of the lateral meniscus, etc. Trace knee fusion, popliteal cyst. Oh, you sent to the clinic. Mail will be contacting you and get you scheduled up for a. Now this says an award. Maybe it is OWCP. Okay, obviously we'll set you up for a scheduled award. If it's that, or if it's VA, we'll set you up for a VA disability evaluation. Yeah, a lot of good stuff. I mean, I'm sorry your knee hurts like that, but we can rate that. Okay, we'll contact you if they haven't already. Okay, all right. Now, this is a good one from Chastity. Federal Workers' Comp. I'm going to read most of it. She's from Texas. I'm service-connected, that's VA, for hearing loss. The reason the VA does this is partially because some veterans fake or exaggerate the hearing exams to get benefits. These veterans don't know that the VA has a sonar-type machine that can actually see if the veteran has real hearing loss or not based on the state of the receptor hairs and inner cells, so they know if the veteran's lying or not, but will not tell him during the exam. Now, that's true. That's true. They've got some good, it depends on the VA system, but they do. Now, VA audiology examiners are usually very jaded because of this and will clamp down if they detect the inconsistencies. Yes, but mostly they're jaded because there's a subconscious bias against anybody who files a claim. Right? Example, my transcriptionist, who's a paralegal and an RN, and when she did my reports, they're phenomenal. Anyway, she gets carpal tunnel. I get her keyboards moved, desk moved. I write a program or lock her computer up every 30 minutes and say, Vicki, take a 5-minute break. Well, she takes the tapes home. She gets carpal tunnel. Anyway, this is state workers' comp. Now, Vicki, you've got to file a state workers' comp claim. I don't want to. You're a Christian, and you're supposed to obey the governor. The governor's rule is you have to file a workers' comp. I've been paying these premiums. You got to file. So she filed. Okay. That what's interesting is my emotional response when I see Vicki come to work. It's go away. Why am I having that emotional response in my limbic system? Why is that happening? Because I know this stuff. I'm the guru. Because workers' comp means fault. Now, let's say she got carpal tunnel from a tornado. My response, you need a new desk, you need a new time off. Okay, so whenever someone files a claim, that means fault, and we fight that. All right, now, so the hearing loss by audiologists is not just this, it's their attitude. As if they're judge and jury. Let's just be pragmatic. And it's not coming from anybody up above. It's just that's how people are. When I started doing legal medicine in the early 50s, I thought 60% of my patients would be legitimate and 40% be faking. That made me amongst normal doctors, not insurance company doctors. Pro-injured person. Well, now it's much higher than that are not faking. In fact, I have to draw a history out. It's hard to get them to complain because they're afraid of being thought of malingering. So, in fact, I was about a barbershop about a year or two ago, and because I'm an old codger, another old codger, talking about all these vets getting this disability and just and I just went ballistic. I said, "Mister, have you ever worked for a company that could kill you? I don't care if you're a vet and all your whole tour was in Hawaii on a desk. The government could kill you." And then while you're in the VA, while you're on service, you can get food stamps, and the law is very clear to take care of these vets. So are you a doctor? No. Have you read the VA law? Have you examined these people? No, no. Well, then keep your goddamn mouth shut. Unless you know this, you want to go outside and discuss that. So that's what I'm fighting all the time, this bias against anybody who files a claim. And it's pervasive in the VA because it's pervasive, subconscious, everywhere. All right. Okay, so they become very jaded. They're jaded anyway. But I've seen audiologists, and I hear it over and over again. When you do an audiogram, you do the test. And the way to do it, when you do it, do the best you can so that it'll show up, it'll stay consistent. Okay? And now, so I had a guy, hearing aids, even yell at him, he couldn't understand. Put my hand over my mouth, he couldn't understand. Has to relapse. His very last is that bad. Under the book, the American Medical Association Guides Evaluation Bourbon, he's 30 or 40%. Under the VA, he's 0. Now, this is why. He does the audiogram, which is the correct audiogram. The audiogram was correct. But then the speech discrimination, the ability to understand words, was 96% speech discrimination. I see that over and over and over again. There's no way this guy understands 96% of the words. What happens is, it's supposed to be someone saying it from a CD-ROM, a Maryland CNC. Okay? But the audiologist keeps repeating it until you finally say, "I understand it." That's outright fraud. Tell them Dr. Ellis said go to the OIG and turn that person in. Okay. So that happens all the time. I hear that story all the time. But Christy, you're on to something here. The audiogram they use at the VA, depends on the VA, is a very good audiogram. All right, now, exaggerate, don't do it. Just tell the truth. Congress law states there must be a shift in hearing loss ability. Yeah, right. To get hearing loss, there's usually it's the higher frequencies, and there must be a shift in hearing. That's right. That's the audiogram. Okay, and then if you don't have a shift, you're not going to have hearing loss unless you had something like otosclerosis that caused the bones made the ears clamp up and it's a straight line. That's not hearing loss from noise. It's hearing loss not from noise. Okay. Then there must be evidence that at least a training accident or combat accident affect your hearing. No, that's not true. Did you have any noise exposure in the service? Anytime you hear noise so loud that you have to raise your voice, that's above 90 decibels, that's OSHA requirement for hearing aids, earplugs, okay? So basic training, everybody had basic training, that's enough exposure to make it service connected. It's about that much service connected, but that's enough. It wouldn't be in state workers' comp, wouldn't be in criminal law, but it is in VA, all right? So if you are a Aborigine in the middle of Australia or in the middle of Congo, old men don't get hearing loss. They call it presbycusis. It's not the X chromosome. They just mow more lawns. Okay, so the hearing loss is that down. But they cheat you by taking the speech discrimination. So when you take the speech, when they ask, do you understand it? If you didn't understand the first time, said, "Ma'am, I didn't understand the first time. Why do you keep repeating it? Isn't it supposed to be a CD-ROM? What's your name?" I'm going to have to go and get one of these person and get them in trouble with OIG to stop this kind of fraud. But there's a bias against the injured litigant, no matter what system you're in, VA or anything else. Yeah. So, and it says it can't show up. Yes, yes, your ears continue to deteriorate. That's wrong, Christy. Your ears continue to deteriorate. All right. So here we got David from, okay, left femur fracture, total knee replacement. Can I file a new claim? Sure. Or now, what we would do, uh, if you already have a knee replacement, and then you have a bad something happens, we can just say reopen that one for treatment, or schedule a ward, or file a new claim. And if you've already retired, we can do a CA2A recurrence. But then also in federal and VA, if there's a consequential. So you had flat foot and ankle injury, and then later in time, you got a bad knee, bad hip, and a bad back. That could be service connected, and certainly would be federal workers' comp connected. You just need to have somebody who knows what the law is and apply it correctly. So how to file the claim and on OWCP, we would present immediately to the claims examiner. Your judge and jury has a 12th grade education, no training in law and medicine. We can either add this new findings as a consequence of the first claim number, or we can file a new claim number, whichever you decide. We don't, and then we give the claims examiner an opportunity which way they want to do it. Sometimes it's easier for the claims examiner to have a new claim number. So you may work for the federal government and have 5 back claims, okay? And so you have surgery and stuff. The way I would rate it is I would combine all the claims together, and that's your rating for a scheduled ward, okay, for that body part. By the way, you don't get in federal workers' comp a scheduled ward for a back, but you do get it for the nerves down your legs. You don't get, if you're a federal employee, you don't get an impairment scheduled ward for heart, brain, spines, the GI tract, because you don't need that to work for the government. No, it's a 1916 law. And the scheduled ward, what's that mean? You got to cut off thumb. There was a schedule. So you have a neck surgery, infusion, and rods, and no nerve pain down your arm, or no nerve weakness down your arm. You have zero impairment. You have a teeny little disc and a major C6 nerve, and have a major impairment of the arm, but it's only as it goes down into the extremity. So if they tell you you can't have a back workers' comp claim, yes, you can, but it's got to be because you have nerves down your arm. And in federal, you have to have what's called an EMG nerve conduction study that you actually measure it. So, okay. Got anything online?
Yeah, we do. Here we have Eagle's Wings on YouTube. Thank you for all you do for us veterans. I just have one question. VA denied my eye condition several times and asked for another CMP. Denied again, but found out the VA didn't even use the optometry exam. Is there something you can help with? I ordered C-file and saw optometry report. She put an X on aggravated and said 12 other eye issues found. Thanks, Doug.
No, yeah, you need somebody to write a nexus report. And then you go back and go through it again.
So talk about the importance of a nexus.
Yeah, nexus report. It's a medical rationale report. A white coat has to say it. All right? And that's the problem. Over 50% of litigation, just a second, I'm going to get a cough drop. Over 50% of litigation requires a doctor's report. Like car wrecks and VA disability, federal workers' comp, Social Security. Okay. So all we learned in medical school about legal medicine was malpractice prevention and that lawyers don't go to heaven, which is the beginning of my class. Okay, now. So reasonable medical certainty, more likely than not, and that's what's in the word he used in VA. Doctors don't understand what that means. So this is what I teach. Medicine is hearsay. The mama comes in telling her kid's had a runny nose. Criminal law, beyond reasonable shadow of doubt, no hearsay evidence. Medicine is basically hearsay. This is what I teach residents in occupational medicine, flight surgeons in the Air Force. They're taking occupational medicine. They may be surgeons and family practice, whatever. So Frank is writing a letter to his wife, about his buddy Joe. They're both missionaries. Endemic for hepatitis A. They don't have a hepatitis A shot. And Frank writes to his wife, Joe's eyes turned yellow today. We've been here 21 days, and they turned yellow today. And then I turned to the doctor. Doctor, what's your thought? Not diagnosis, not opinion, no lab test, just with that hearsay evidence. Well, he's got hepatitis A. That's where the hepatitis, it messes up the liver, makes the bile get in your bloodstream, and turns your eyes yellow. That's reasonable medical certainty, federal workers' comp, and personal injury, but more likely than not in the VA. All right? Then you get a CAT scan, and there's a gallstone in the gallbladder that can back up the bile that goes down the bile duct. Instead of going into the intestine, it gets in the bloodstream and turns the eye yellow. What's your thought? Well, he's got a common duct stone. Okay, that's reasonable medical certainty, more likely than not. The lab test comes back, and while he's got the stone, he also simultaneously has hepatitis A virus in his liver. So at each point in time, with the information you have, that is reasonable medical certainty, VA more likely than not. And every time they, oh my God, I've been screwing people for 30 years. You have, because you have no training. I've forever seen emergency rooms. I had our poster child, guy works at the FAA, gets crushed, and of course we're worried about ruptured spleen and intestines, which is emergency, but he's also in a coma from a head injury when he fell down, and so they get a CT of his head and his neck, and so he leaves the hospital, and they forget to mention the coma. It's in the records, but they didn't put it in the discharge summary about the coma, brain injury, and the neck. So the claims examiner in federal workers' comp said, I will never accept his neck. Well, I see him 6 months later, because first of all, he goes to a neurosurgeon, the PA sees him and misses it, okay? I'm not going to condemn the PA. Most times when you have a neck and pain down the arm, it's coming, this is the spine. It's from an outside nerve, peripheral nerve. This was a spinal cord injury, like Superman. The spinal cord is hurt, and that stops everything down. Well, I see him 6 months later, big muscular guy. His left side looks like he's had polio since he's a child. I mean, you could see it 30 feet away. Atrophy. That's the spinal cord. That's an emergency. So I sent an actual MRI with colored pictures and arrows and everything to the claims examiner. We needed emergency surgery. I will never accept that. So he did the surgery on his health insurance. Finally, 4 years later, that claims examiner was changed, and we got the neck approved. Okay? So now you know why I get pissed at governmental agencies and people that have bias and power and are not held accountable. If an insurance company did that, that'd be $1 billion bad faith claim. Punitive damages out the wazoo. You don't even know the name of this person's last name. Okay. And same way with a raider in a VA claim, or an audiologist that has an attitude. And I don't think it's coming from above. I think it's pervasive. I had it. Still do. Because to me, legal medicine is, I think you're a scuzzball and liar until I believe you. Then once I believe you, I'm on your side. Okay, what else you got?
Well, this is a good segue into the next logical question, is how individuals get your help. Is Eagle Wings or Doug on YouTube follows up. If I send you CMP paperwork copies, can you write this letter, and what is your charge?
You go to ellisclink.com, click VA appointments, follow the bouncing ball, send the records, get them in order, put them in order. I'm not your secretary. I'm not your mommy. I'm not your representative. To keep our prices down, you've got to take your claim and run with it. If you don't know how to put those records together, get someone to help you. Every state has a Veterans Commission that'll help you do that for free. All the agencies like American Legion, DFW, all have veteran service officers trained by the VA. Put your records together, get a summary list that I can attach to the report, and then we'll write a report. It could, sometimes we can do telemedicine. Sometimes you have to be seen.
All right. A follow-up that he has is, does he need to come in?
It depends on the condition.
What would necessitate not?
Well, if we're going to do a knee, I need to do the range of motion.
Okay.
unless you've got a doctor in at home that can give me those measurements, and I can say, because I base my opinion on my phone call and the video helpful, and then review the records, and then we can have the range of motion. That'll be helpful. Well,
So, I think that brings up a good point about VA medical records, because a lot of veterans don't have their medical records.
good point. Thank you. Thank you. Thank you.
Talk about that.
Okay. First of all, no one goes to the doctor during basic because the DI is going to. It's a bad thing. And pilots never. I say the only time I see as a flight surgeon in the Army is the pilot is for the flight physical. Everything else is the officers' club. Doc, I got this friend. I said, give your friend this prescription and go get it filled, or they'll get grounded. Okay, that's just life. Okay, and also back then you had more testosterone than brains, and so you don't go to the doctor. But if you tell me that you had flat feet before you went in the service, and they got worse running around in combat boots and 40 pounds on your back, and that's all it takes in federal and VA. Okay, state workers' comp wouldn't let you in. You're not going to win that. I'm not going to waste your time. But VA and federal, I know the law. It's very ridiculously fair, right? And then we can do it. And so a lot of it can be You can always do television or video. Then if they don't like it, we'll see you.
So when it comes to your medical rationale, how is that weighted when it comes to legal terms?
Well, very well, because no one knows legal stuff. No one knows how to write the magic words. Like I got a call from Raider in St. Louis. Oh, Dr. Ellis, you're so wonderful. You give us a logical history. You look up the codes, the percentages. We really appreciate that. And your medical rationale just makes sense. All right. And now, if you'll go to Board of Veterans Appeals, VA Appeals, and Google the word Ellis, you'll see, based on Dr. Ellis' report, remand. And it's not that I'm any good, it's just no one's trained in this stuff. Right?
So let's transition to, well, before we transition to federal workers, let's also highlight the importance of why certain disabilities are important to get rated with respect to the spouse.
Okay, yeah, right, yeah. So what happens is you put your life on the line for your government, and then you go with the VA and some asshole, you could pick up the vibes that he's not, or she doesn't like you, doesn't believe you. You're picking up the vibes, and it's personal, man. I mean, if you're working for Manpower and had a state workers' comp claim, you had to get a lawyer, you wouldn't be surprised. You'd be surprised if they treated you. But when the VA does that to you, that's family. That's a psychological burden you're stuck with. And you quit. Don't quit. So if you get 10% for tinnitus, which almost everybody has, it's when they don't have tinnitus, they go, really? Okay? Because the ear's really sensitive to noise, okay? And just down the range is enough. Okay, anyway, then if you have a stroke or heart attack, which is a common reason men die, then I can write a widow's pension letter that service-connected tinnitus contributed to hypertension, which contributed to the stroke or heart attack, and therefore it's a service-connected death, and the widow and the family gets the pension. And that's a fun day, folks, but that's the law. Wouldn't do that in state workers' comp because that's not the law. But in federal and VA, the law is if it contributes, if the slightest amount aggravates the slightest amount, it's covered. And no one believes that, no one knows that, and no one applies it. I just do.
All right, so let's transition, while we're waiting on some more questions here, to federal workers, and specifically the capability of a federal worker to choose their own physician.
Okay, good point. Okay. When you get hurt and they send you the doctor, you can go, but if you go the second time, you've picked a doctor. But that's okay. You can always change doctors. You just have to ask, you have to give a reason why. Okay. For instance, if you get hurt and you come see me and I'm doing stuff, we send you to an orthopedic surgeon, then you don't have to change doctors. That's just automatically, they do the surgery, they send you back, and we do paperwork and all the forms and the things you need in federal government, and then we're doing that. And then but let's say your doctor died. You send a letter, I need to change, my doctor died, my doctor doesn't want to do it anymore. But the best thing to do to change doctors is have your doctor send a letter, or just on a prescription pad, referring to Dr. Ellis for follow-up on his federal workers' comp claim, OWCP claim, or let Dr. Ellis do the scut work and I'll do the medical work. Because I'm licensed to do brain surgery, it'd be malpractice. I'm not trained. So, doctor, if you don't know federal workers' comp, don't do it. Had a guy, wonderful doctor, 5 surgeries on this federal employee, did them all under federal workers' comp, so it wasn't on insurance and copay and all that stuff. But anyway, he'd had a total knee replacement. And the doctor, when will I be at maximum medical improvement? That means he can get that scheduled ward. The doctor correctly said, based on his training in medical school and residency, well, never. You're always going to need shots and physical therapy. But based on the federal workers' comp law, he's really wrong. It would cost that man $310,000 for a scheduled ward. He's ready for one. That's maintenance. Now, if you're getting ready to have surgery next week, you're not at maximum medical improvement. If you have carpal tunnel surgery, I can't do a scheduled ward for a year. You got to wait a year. Okay? But your maximum medical improvement, when treatment, although it's ongoing and active, it's not going to make a difference. And the doctor explains that. Okay. But anyway, fortunately, he hadn't been on the webinar, and he came in and got his knee fixed, got his knee paid. Especially for now hospitals. Let's just think about this. Let's say you're seeing federal workers' comp, and this happens. And during this, and so 10 years later, this guy finds out, well, his kids were in college. He could have gotten $310,000 and not had to get a student loan. He will hate you and your hospital forever and ever and ever and ever and ever and ever and ever. It's better leave a sponge in on surgery. So don't get in this unless you know this and your staff knows it. And I'm telling you right now, they're not trained. They don't know it. People come from all over the world in both oceans to see some hick doctor because no one knows the nuances of federal workers' comp. And they're afraid of the government. And I'm not. Okay.
So that's a good segue into the difficulties both based off of from the veteran perspective and federal workers. And so one thing that you always recite is never give up. Talk about that.
Amen. You can just keep repeating VA, repeat federal workers comp, repeat it. Come in another door, do this, do that. It never closes. Just don't give up. We had somebody on, you always went. I said, no, you quit. Came back, we got him taken care of. Okay? So don't give up, and we don't give up.
Well, talk about that process, especially regarding, being told no. Because these individuals, like you said earlier, you don't necessarily know their last name. But once you get to a certain point.
Okay, so you've got a claims examiner. So, and then you can do an oral hearing. You can do a review of the records. You can do an oral hearing. Here's what's funny. The government's had to put oral hearings on hold. They can't find anybody to do transcription. Okay, all right. Anyway, an oral hearing, or you can go to the Employees Compensation Appeal Board, which is the Supreme Court. But now, every time I've done an oral hearing, or ECAP, we're talking to very intelligent people, just fact, law. They know it well, and they know the law, they're applying it correctly. They understand how fair it is, and they apply it fairly. So it's honest stuff.
So let's.
But see, doctors are never told how to do an oral hearing.
So let's transition to the process of, you mentioned to Doug is that you fill out a form online. So whenever they get in here, take the federal workers.
Federal workers, we do the stuff, we file it. Then if you get a denial, or they send you a second opinion who denies it, then we take that and we just look at it and then say, now we're going to do this. And they deny it again, we're going to do this, we're going to do that, we're going to do that. The law's on your side. You don't have to give up. But you're going to have to find somebody who knows this. Now, in federal workers' comp, folks, I'm sorry, but I do not know of an attorney that would reckon federal workers' comp. They're afraid of claims examiners. Okay? Wouldn't recommend it. A lot of good attorneys in VA, but I don't know one. Now, if you're doing FERS, or federal retirement, you'll need an attorney every time, because now, even though federal employment retirement services system, which is federal retirement, you can't do the job with your hired, is very, very, very fair law. A couple years ago, the Boyer retirement system, probably some clerk in some basement, decided they'd fight them all, like an insurance company. We're going to fight them all. And so you do that, and then you have to get an attorney, and you go, and then you win it. Just like about 90, some, I don't know, but a high percentage of Social Security is turned down. And it's your money. And then you get an attorney, and you go and talk to a human being and win. I don't think it's a rule. I think it's just people have a bias against the injured litigant, which I had. Okay?
We got a question here from Elaine Smith on Facebook. Can you receive a scheduled award after having 3 lumbar discectomies and 2 fusions? Also, neurostimulator implanted. Back problems appear to be difficult.
Okay. If you have no numbness or weakness down your legs, you have no scheduled award. There's nothing for the back. But if you're having numbness down your leg, weakness down your leg, and a positive EMG nerve conduction study, which is a torture test, then I can rate the nerves down the leg, which you probably do. The odds of you not are 0. Yeah.
We got a question here from Mr. International on YouTube. I'm a rep for a vet that sustained TBI from engine part strike. Later got bad contact discharge. Seeking guidance to help him qualify for VA benefits due to TBI related prolonged behavioral changes.
I'm your guy. I started a walking wounded brain injury clinic years and years ago. The way I got into it was a state workers' comp claim. So I've got a patient who has a brain injury, and he also hurt his back. And I sent him to this neurosurgeon for his back surgery, and then he does his back surgery. Then he releases him, and this is state workers' comp. And I called the neurosurgeon up. I said, well, don't release him yet. I'm still treating him for his brain injury. In other words, once a month I get together with the occupational therapist, the speech therapist, and the family, and the psychologist, and we explain about Daddy, okay? And so okay, and the neurosurgeon said, what brain injury? Oh, I'm self-righteous. I'm madder than hell. See, so Jerry comes in next time. He's got his cowboy shirt on, pressed, clean belt buckle, clean shaven, everything fine. How you doing, Jerry? Fine. How's your wife? Fine. What's your wife's name? He doesn't know. He's 100% brain damage. But when you have really bad brain damage, you don't know it. So his wife would bring him in and get his surgery. And so the neurosurgeon did miss the diagnosis. Okay, now, and then there's no such thing as a minor head injury. Now, by the way, the 8045 form on the VA for brain damage is awesome. I use it for everybody. And that's how you rate brain damage, yeah.
Well, let's talk a little bit more about the.
So the brain damage. So should he have had a dishonorable discharge? We can overcome that, you know.
Yeah, so, and really that path would be utilizing your medical rationale.
Well, yeah, we do medical report, yeah.
Projections about-
Yeah, whether it's discharged or not, he got hurt, he got dinged into the service and rating.
So,
And he may be individually unemployable due to his brain injury. That's a lot of money.
all right, let's talk about the connectedness of certain conditions. Because,
Before we do connectedness,
Yeah.
a negative CT scan, and MRI, and EEG brain does not mean you don't have brain damage. Okay? It's subtle. You ask questions. You need to look at it. And a lot of, like the NFL, fought brain damage. We've known about boxers and brain damage forever. And they fought that. And you let some neurosurgeon, NFL, ruin your PR all these years, and you get all the way to the goddamn door of the federal court in Chicago, and you settle for $750 million. You guys need me on your PR team. Now look, and we help brain damage, which you should. Boxing and football should be outlawed, and I love them both. God help me, I'm a bad boy.
So that's a good segue, just because the connectedness of a brain injury to, say,
Right.
bad conduct discharge. But there's also the connectedness of certain conditions to other conditions that.
Oh, absolutely. Sleep apnea is now covered. Okay? Absolutely. The brain messes up with your tummy. You get GERD or you get irritable bowel syndrome. That vagus nerve it's all covered. Yeah.
Follow-up from Mr. International on YouTube. He got out the military at 100% rating, but he wasn't eligible for compensation due to his discharge type. So, because bad conduct.
Oh, bad conduct, okay.
So,
Well, let's overcome the bad conduct,
and
if that's possible.
it would be through the Board of Corrections for his service.
Okay.
And
Thank you, Miles.
Using the medical rationale that you could provide for.
Sure.
And especially given if he had that rating at the
Right.
time of his discharge.
Right, yeah, he's got a brain damage, and it's behavior probably was from the brain damage. And he can't defend himself with brain damage.
Oh, well, hey. So,
Like beating up on somebody in Special Olympics, that's not fair.
the connectedness of decisions, or of conditions that people don't know about, but there's also presumptive conditions.
Oh, presumptive. Okay, now, for instance, burn pits are now a presumptive condition. Let me explain. Don't be mad at the VA. I was winning burn pits for years, and because I would say they're around the burn pit, they're burning jet fuel. Inhaling jet fuel hurts your brain, hurts your lungs. The lungs can't handle oil. They handle smoke real well, they handle dirt, but they can't handle hydrocarbons. Then we're burning all this plastic stuff, and we've got a chem lab putting out all kinds of stuff, and a lot of them are carcinogenic. And so, based on that exposure, it's my medical opinion that it's bronchitis, COPD, cancer are service connected, and we'd win that. But now they've done what are called prospective epidemiologic prospective cohort studies with chi-squares and all this stuff, the stuff that Fauci understands, that epidemiologists understand. By the way, whatever you think of him, he's the one that predicted the HIV epidemic. So the guy's an epidemiologist, part phenomenal. So then it's presumptive. And so burn pits are presumptive now. Vietnam, Agent Orange. People, have ranch in it, and their kids are weird, and they got all kinds of stuff. Finally, they did enough studies to show that it's service connected, and that's a presumption. You step 1 foot in Vietnam, it's covered. Obviously, that's not science, that's politics, based on we want to make sure we don't miss anybody. If we're going to err, we want to err on the right side. God bless your government for doing that. Or if you're 3 miles out in a ship, and you've not had any exposure hardly, but it's covered. But it's presumptive. So there are a lot of presumptive PACT Act and things like that are presumptive. But in the meantime, a doctor can just address it with common sense. Okay, I love the young man, Desert Storm, weapons of mass destruction. Let me tell you what. Talk to the 250 people in Tokyo that died with sarin gas exposure. And that's mass destruction. Now they're making big vats of sarin gas, you dumb shits. Now it wasn't an atomic bomb, but that's mass destruction. And then we go blow that stuff up and it waft all over the dadgum desert. You dumb shits. My God. So anyway, I've got this vet, he's got brain damage from it. He wakes up with a headache, the dog's dead, the siren's going off, and he's been trying to get brain damage from sarin gas exposure for years. I said, okay, here's what we need to do. I want you to take off your Desert Storm stuff. I'm proud of it. I said, I'm just telling you life. Now you wear slacks, a shirt, no tie. And you take this to your doctor. And I wrote on a prescription pad, doctor, I think you had sarin gas exposure, blah, blah, blah. I asked for some tests. I did not ask for a neuropsych test. That's a 2-day test, it's expensive. And of course, he comes back, they accept it, of course. Because what happened, he goes in, he hands that to the doctor, he goes, here, nurse, do that. And he's through with his class. And of course, it comes back positive, and we've got him covered. I'm just telling you human nature, but we got it covered, all right? So you just need someone with some common sense, which is hard to find amongst us doctors, and be able to know how to do the truth and tell the truth no matter what. I don't, no vet, I don't think your glaucoma is service connected, and I'm keeping your $500 because it's harder to tell you no than yes. Well, you're right, Doc. I appreciate you being honest.
We have a question here from Manny Rogers on Facebook. Can you get a good rating for carpal and metacarpal arthritis and tendonitis of the hand and wrist?
Oh, yeah. Oh, yeah. Ouch, that hurts. That hurts me hearing about it. Oh, yeah.
Talk about the...
Well, you rate it for the arthritis. Then you also rate it for range of motion. Yeah. And you can also throw a grip strip in.
Right.
Speaking of that, okay, I saw a vet once. I got 10% for knee. I said, so he had a meniscus tear. I said, sit down and measured his ligaments. If you have a ligament, say the middle metacollateral right here, okay, and if it's slightly loose, that's 10%. If it's moderately loose, it's 20. If severe, it's 30. Well, he had a metacollateral ligament that's moderately loose and an anterior cruciate is moderately loose. No, you got screwed out at 40. You didn't get 10, you got screwed out at 40. Because the doctor doesn't know how to do a VA exam.
It's a great segue to our next question from DB Cooper on YouTube. I was just graded 10% for sinusitis and 20% for irritable bowel syndrome, but my symptoms clearly fell under 30% for each. It's my best option in a higher level review or supplemental plan. For IBS, I have IBS logs I've made.
Oh, beautiful. No, that can we do by telephone. Just get another report. No, another report's new medical evidence. And we'll rate it the way it's supposed to be. The book's very fair. It's old. I graduated in 68, medical school, Parkinsonism. In the book, it's called paralysis agitans. So you've got to know to go there to rate it. But the book's very fair. The VA law is very fair. The Congress clearly wants it to be fair. It's just the trouble is we doctors are not trained and we have a bias. I have a friend of mine, who does VA C&P exams for a company. I'll mention it someday. But anyway, he gets letters saying, you're finding a lot of extra conditions. In other words, if you keep doing it, we're going to fire you. Don't you think you ought to get a medal for that? Same way. After Vietnam, flight surgeon at Fort Lewis, Washington, doing internal medicine residency. Thank you, Army. That was phenomenal. Wow. First name basis. Anyway, the general comes in. General and I are friends. I check oysters in his beach house. Doc, we're getting more complaints about you. You're finding more in the exit physicals than all the other doctors in this unit combined. Well, I know what's going on. It's top sergeant. He's telling these kids, if you file for anything on your exit physical, I'm going to keep you an extra week. Now, that's outright satanic, evil fraud. And I said, General, did you get a call from Washington? No. Have you read the VA law? Nope. Let me tell you something, General. I'm so goddamn smart, I didn't have to keep notes in medical school. I'm the smartest one in any room I walk into. That's just a fact. And I read the law. The law is ridiculously fair. I apply it correctly, and top sergeant's ass is now mine, and I'm not going to change. I don't want you to change. General, does it really matter what you want? Well, I guess it doesn't. So you guys watch that at top? I think you've opened a can of worms. So I come to see these bars. You'll stand at attention. Here are your new orders. You empty these trash cans 4 times a day, and then right out my window is a dumpster. I want to see you take that trash can and turn it over and empty it in there. Well, there are 415 clerks in there. He's emptying air because they're taking the trash out. Comes in Saturday, salutes. If you had an attitude change, Sergeant? Yes, sir. Now, let me tell you what happened after I left. He went right back to it. Probably even worse than it was before. Because he's a human being. Because we are... That's number one assholes. Jesus didn't come down because I'm nice. So I know, since I'm the number one asshole, I know how assholes work and think.
We have another comment here, which I think goes to the notion that you shouldn't give up, but interesting nonetheless. Ray McCarty on YouTube. I was previously denied sleep apnea after using your service. They used 2 ACE exams to produce the denial. I used another doctor that built upon your work with multiple paths, such as diabetes.
Yeah. Diabetes, tinnitus. Tinnitus can treat sleep apnea. It messes up your eye movement sleep. Yeah. That I wouldn't do in state works. I certainly wouldn't do it in criminal law. But that's the criteria. That's the level in federal and VA. And no one knows it. Especially doctors. We don't have any training in legal medicine except what we watching. This is going to date me. Watching Perry Mason, but watching law shows and TV. That isn't the VA law.
Now, Ray McCarty.
That won't date you anymore. They brought back training.
They brought break. Okay, good.
As a woman.
Thanks, Gary.
Ray McCarty follows up. Now they've requested an IMO to get a second opinion, not even an ACE exam.
Well, get my report. Throw it. Just head to head. Let's do them.
So talk about that a little bit more, I think it's important to note to our listeners is when you come see your clinic, it's not saying that it's going to be an immediate win. But
No, it gives you new evidence, and then you get going. Now, if you go to the Board of Veterans' Appeals, it looks like now the boards of the Veterans' Appeals are the judges are lawyers. They know the law. They apply it fairly. It's just getting through. Depends on what state you're in. Muskogee's kind of the middle of the road. Some states are, I mean, just awful. It's like being a black man at a KKK meeting. They're so bad, so biased. But like I said, a call from a lady from St. Louis. Oh, Dr. Ellis, you're wonderful. Said, lady, don't say that out loud. They'll fire you.
Ray McCarty follows up. Recently, the quote, not service connected, end quote, disappeared from my individual rating.
Well, good for him.
Yeah. Which, just anecdotally, these processes are long. I saw you originally in 2020, and I'm still, going through the rigmarole of Board of Veteran Appeals.
Right, and by the way, Miles is the guru, which you said BSO, he'd be the one you want. Yeah.
So let's, while we're waiting on.
Oh, and speaking of that, so you have hearing loss, and they say denied. It needs to be rated at 0. If you have tinnitus, you've got hearing loss. It may always be 0, but even though Christy said it doesn't continue, it does. Those little hair cells, like hair, but it's not hair. It's the cells in the ear. Once they've been injured, they continue to withdraw. Okay, and so then eventually you may have a 20%. But if it's 0, you don't have to overcome acceptance. So we want a 0. And a lot of times I'll do that. I'll see somebody and I'll say, oh, I'm going to put a little blurb in here and put that in. We would request that be rated at 0. Or a lot of times I'll do I'll do a telemedicine and do a hearing exam and say, based on the history and it's my medical opinion, it has noise-induced hearing loss, I would recommend an audiogram to VA with a Maryland CNC and an audiogram. Or I was talking to a guy the other day. It said, "Do you have sleep apnea?" I think so. I turned to the wife. I said, "Does he stop sleeping?" Yes. That's my diagnosis. There, I've got it. That's all I need in this venue. That's enough. And so we'll write a report. It's my medical opinion. It's more likely than not he has sleep apnea. I'd recommend a sleep study. Let the VA do it. Then if it's there, you get it. If not, you got a free sleep study. It'll be there. Okay. So it's hearsay.
Ray McCarty commented again twice. AI has indicated that this could be a positive move, and you did my generous claim, which was approved and part of the strategy.
God bless him.
So,
yeah. I paid him money to say that.
All right. So I want to take us back a little, and for initial claim evaluation and can you walk us through what the initial steps a federal employee should take when filing a workers' compensation claim?
Okay, depends. If you've got an acute claim, file it. You fill out a CA1, file it, and then go see the doctor. Come see us if you need stuff. Again, now cumulative trauma, like carpal tunnel or things like that, start with somebody that knows what they're doing first. Don't just go to somebody that does the surgery. Get that done first. And then VA, veteran service officers, listen to me. We need you. It's not veteran service officers, but nexus support. It's both. You need both. You need a doctor's nexus support, medical rationale, medical opinion, and the VSO putting the records together. But records by themselves are never going to meet the criteria for VA. Sometimes the rating officer will go ahead and do it, but it's not based on any medical evidence because it's just medical records. You've got to have a doctor take it to that step. Based on all this, it's my medical opinion. It's more likely not that this condition is related to this condition, and that's what makes. But you've got to have the nexus support. Start with your nexus support, VSOs. Start with it.
All right, let's talk about a little more. Is what common mistakes do you see early on in medical exams or reports?
Well, now in VA, it's not having the nexus support. Start with that. Don't do it later. Start with it. Come in with all guns blazing. You don't just get your medical records. Now, buy medical records. Let's say you've got a medical record and sleep apnea. I want every runny nose you had that you saw in the service, but I don't need all the records. For instance, if you have a shoulder surgery, I just need the op report. I don't need all the hospital records, what the nurses wrote. But in military records, if it's anything to do possibly with your, let's say you're filing a knee claim, or a back claim, that if it was something on your foot, you saw something from a knee, and of course, obviously starts back. I want those active duty records, right? But if you have no active duty records, that's okay. Right? And so you have so you have a sprained ankle. Then later your knee and hip and back bother, that's sprained ankle. And then you tell me the progress and how it went. And if it makes medical sense to me, I will make that opinion. If it doesn't, I won't. You might get mad, but that's okay.
All right. Well, we're here in the last 10 minutes, so if you have any final questions you'd like to ask, go ahead and ask them now. But as far as the question I'd like you to answer is if an individual needs to see a specialist after their initial visit, what steps do they take?
Well, it depends. If I see you and I'm your treating doctor, I'll send you the specialist for federal workers' comp. For VA, or the claims examiner may send you a specialist for a second opinion. Right? So you get that. So and unlimited treatment in federal workers' comp, unlimited treatment for the VA. But the VA may send you to CMP. Now, I did have a person, a federal employee from Ohio. His job is to go to the different states and teach the raiders the law. Okay, and he says that the many doctors, nurse practitioners, and PAs in the VA are not trained. They're just thrown out there. And so he came all the way from Ohio for my fellow doctor to do a nexus report for him because we talked politics. But I thought that was interesting because I've seen that. I've seen some denials, they're just beyond stupid. Yeah, like 3.5 years artillery didn't contribute to his hearing loss. Yeah.
Well, not only.
Yeah.
Since we're closing out the webinar here pretty soon, I wanted to ask a question because I feel that it's important to really hit the nail on the head about the importance of getting seen and understanding that you may deal with backlash, especially federal workers. Charles.
Oh, yeah.
Good example. But talk about functional capacity evaluations and how that affects work.
And federal workers comp, a functional capacity evaluation can be a very beneficial thing. So it's because it's a little bit more objective, still subjective, but it's a little bit more objective. But in other words, 35 pounds may be the maximum, and so it just has a lot of cachet. It carries a lot of weight.
But this is a light duty, for example.
Yeah, but it's not light. In federal, it's not light duty. The federal forms, the CA-17, that here's the job and these are the things they need to do. Then in federal, your doctor is God. Your doctor decides what you can do, not second opinion doctors. Not okay. And so I write down what you can do, and then they decide if they've got a job. Now here's the problem. If you're a supervisor and you've got to accommodate all these people with injuries, because we all have injuries as part of life, it's a pain. And what they'll do without even knowing, they'll try to get rid of you because it's just a pain to accommodate all that stuff, even though they're paid for that. I understand that. It's a pain. And so it's better just get rid of you. Like the post office, in federal workers comp, the Employee Compensation Appeal Board said, don't do videos. It's not medicine. It's not law. It's stupid because it may be not the job they're doing. Post office does it all the time to intimidate you, get you quit. So if you're getting video surveillance, go to Ellis Clinic, look up the video surveillance handout, and then get your fanny in here to see me so I can cover you. I've done 1,590 trials and depositions. Every time I've been to federal criminal court for federal employees, the judge has threatened the prosecuting attorneys with contempt in jail. Now, you prosecuting attorneys, you better know your shit, and I'm going to kick your ass, and I do it. Read my transcripts. I expect you, if you're going to get paid, to know the law and follow it.
Well, I think Tom Majors. So I put it up on the screen now. So just quickly describe this.
Okay, the doctor works at the VA, gets carpal tunnel. I'm a treating doctor, and it said no more than an hour a day on state keyboard. So it gave her carpal tunnel. She's an internal medicine doctor. And so VA is part of the harassment of whistleblowers because she was getting paid less than the men and wanted to get paid equal in this woke time. Changed her hours from 8 to 5 to noon to 8, so she couldn't take care of kids. So she'd work for me in the morning and do VAs. And Tom Majors, who, and I'm going to use his name, he deserves it. He's too stupid to even look up the law or get a clerk to look up the law. Thinks how some of that, she's working for Ellis Clinic her time off is some kind of wrong thing to do. So he files criminal charges, 5 years in jail, $250,000 fine. And so we go down to the federal building. First of all, our attorney should never let that happen. If you want to see my client, you come into my office. But anyway, and he does the showbiz deal. Comes in, yells. I've been on your website and YouTube, and you don't like U.S. attorneys, you say you'll kick their ass. I started those things in 2005. Now, when I started saying that, and what I just said, I'm not stupid. I know it puts a target on my back. But I'm telling you, I know this law, and you better know it as well as I do. You may be my first witness to show you how hard it is on these people, not dealing with people that don't know the law. Anyway, and so I told him kick his ass and did.
All right, we got one final question here. Can chronic fatigue syndrome and sleep apnea be rated separately, or will the VA try to combine it?
They will try to combine it. They like to take PTSD and depression and anxiety. Those are three different parts of the brain. So just like two different arms and a leg, it's three different parts of the brain. It's got to be separated.
Right. And one final comment here. Michael Heisley on Facebook. Absolutely love you, Doc Ellis. I'll be seeing you soon.
Okay, love to do this. This is my hobby, folks.
And we'll be back on the first Friday of each month at 11 a.m. If you'd like to get your questions answered, go to AskDocEllis.com and submit them before. Doc, any parting words?
Love you. It's a blessing that I get to do this. Okay.